Hello, everybody. My name's Emma Duncan, and I'm the current president of the American Society for Bone and Mineral Research. Today, I've got the pleasure of talking with Dr. Elaine, who's the chairperson for the Professional Practice Committee. Welcome, Elaine.
Thank you, Emma. I'm very glad to be here.
Yeah. So, Elaine, as we talked beforehand, I asked people a series of questions about your committee, starting with what is the role of the Professional Practice Committee?
So the Professional Practice Committee is usually composed of clinicians who participate in ASBMR, and our role is really to comment on anything regarding clinical practice that's in the realm of bone and mineral disorders. And so we provide this role as advisory both to the Executive Committee and Council. And in
Yep.
addition, we are often asked to comment on various organizations that are also putting together consensus statements. This could be either by sending one of our PPC members as an official part of a consensus statement, an
Yep.
organization to develop one, or to take a consensus statement that's been put together and to review the clinical implications, provide our feedback so that we can better inform the bone community about best practices moving forward.
So I think that a lot of this is incredibly important from a policy and governance perspective to make sure that our engagement with various position statements and so forth is well thought through, and the implications for us as a community are very well articulated. And I know it takes a lot of work.
It does. But actually, everyone who's volunteered for this has been so incredibly generous with their time and excited to be actually contributing to something which has a measurable impact in terms of clinical care. Because many clinicians look to these statements in order to figure out what is the best way forward. And I think especially ASBMR, we are so well positioned. I mean, there's many communities and organizations that are focused on advocating for bone health, and we appreciate them all. But I think ASBMR is unique, and one of our strengths is that we really embrace both the researchers and the clinicians. And as such, and as a clinical investigator myself, we are often seeing at our meetings the leading research, cutting edge findings being presented at our meetings, published in our journals, and that really gives us the best insight to be able to comment on these topics. And so I think by providing that perspective, we can really do a service to our community, and that is indeed our goal.
And you mentioned there right at the start there, people being very generous about volunteering their time and so forth. What led you initially to start to volunteer for the ASBMR?
Yes. So, well, I've been a part of the ASBMR for, oh goodness, I can't remember how many years. I'm going to be dating myself, maybe 15 or 20. I'm not sure. But in any case, I have always considered the ASBMR to really be my academic and professional home. And I've wanted to give back in some way for many years. And I started off by doing so in some trainee committees when I was a trainee. And eventually, because clinical practice is a part of what I do in addition to my research, I volunteered to be just a member of the Professional Practice Committee. Really enjoyed my time. Had the opportunity to comment on a lot of interesting concepts, some of which I was familiar with, and some of which actually was a great learning experience for myself. And from that experience, I was able to get enough exposure to the Professional Practice Committee that when it came time to discuss thinking about moving forward, and I this opportunity came to me to potentially become chair. I decided to look into it more. I spoke with prior chairs, who had just wonderful things to say about both the work that is being done and also the community of the other PPC members who are volunteering for this. And the experience and my personal experience has also been very gratifying.
Which is wonderful to hear. And as you said, you're a practicing clinician as well as a clinician researcher. Do you find that the work that you're doing in the PPC informs what happens in your day-to-day work, whether that's your day-to-day clinical work or your day-to-day research projects?
Absolutely. So the types of topics that we've commented on in the past have encompassed anything from hypoparathyroidism, best practices for how to do bone density, talking about new guidelines for XLH, thinking about the annual update to the American Diabetes Association Standards of Care, where we provide actually the language for the bone health section for all patients who have diabetes and how they should be managed. And there is a whole variety of other topics. This is just a small smattering of the types of topics that we've encompassed. And separate from those individual topics where we're reviewing existing or helping to craft actually these consensus statements, we also have the opportunity to actually drive the conversation, and that the PBC is able to propose topics for ASBMR working groups or ASBMR task forces, and not only to propose the topic, but to draft the charges, to determine the task force members. And this really is an opportunity to determine new areas which require additional attention. And again, because we have at that forefront of research, clinical care, we often have the ability to see, for example, red flags. So with denosumab discontinuation, we've put together a task force now to try to compile all the existing data on best methods of handling discontinuation of denosumab treatment, which we all know is a tricky situation.
It's complicated. Yep.
Yes, and so in so doing, we can provide guidance and again lead the conversation in this space.
I think it's in one sense, it's a little unusual as a committee because, as you say, this is actually a place where you are creating and distilling the knowledge for the world in clinical bone disease right at that very edge of junction between practice and research findings and trial data and so forth. And that's a little unusual. Many of our committees are more society focused or are advocacy focused, but this is really at the core of bone and mineral clinical care.
It absolutely is, and I think that's what drives the volunteerism that we see from our members. And I encourage all those out there who have clinical practice to and who are interested in these topics to consider volunteering for this very rewarding committee.
I know that we're coming up for volunteer time shortly, so I know that that's going to be music to Jen Westendorf's ears as she starts to put together the slates for the new committees. So my very last question to you, Elaine, is something about you that perhaps the membership might not know. You know, something about you from your private life, perhaps, or what you enjoy doing outside of work.
So as much as I love bone and as much as I love work, I do have interests outside of work as well.
No, surely not.
And one of the things that I really enjoy doing is singing. So I actually sing in a choral group. We sing various pieces across the classical spectrum. I've been doing this for since my college days, actually. And we perform twice a year. So if you're ever in Boston and you want to hear some good choral music, then let me know and I can give you the dates.
Well, we have a certain meeting coming up in October in Boston, so I'm sure this will be a chance for those people who arrive a little early or are staying a little late to come and listen to you sing. Thank you so much for your time today. I'm really grateful.
You're welcome. Thank you, Emma.